Well, the Leapfrog Group, a nonprofit organization striving for safety in healthcare, releases grades of hospital systems across the country, with Minnesota landing close to the top.
Here in our area, some hospital systems scored A's, B's, and C's from the organization. So let's take a look. Mayo Clinic scored A's for the Rochester and Austin locations. Olmsted Medical Center in Rochester earning a B, and in Winona Health receiving a C grade from that nonprofit.
Even with those higher grades in our area, the shortage of nurses across Minnesota is putting not only patients at risk, but also nurses as well. And the latest numbers are pretty alarming.
Today, a group of nurses gathered at the state capitol to share those results and their concerns. It's called the Concern for Safe Staffing Report. The name suggests it outlines areas where short staffing and limited resources are having a negative impact on patient care.
Let's take a look at some of those numbers. For example, with regards to delays in care or delay in treatment of patients, Minnesota is up just over 13% from the year before. Delays in medications is up nearly 20%. And listen to this, attacks or injury to another patient, staff, or visitor is up more than 113%. Well, earlier today, I had a chance to talk with Carrie Mortrude. She is a registered nurse and nursing staffing specialist. There are several areas that specifically are related to this shortage of staffing and also possibly supplies and conditions. Let's talk about the top areas of concerns that patients should be concerned about, as well as nurses.
So and patients we're starting to see actually understand this and are experiencing it, feeling it. So when nurses don't have enough time to spend with each patient, patients get less care. And so it should make sense that if you just keep giving me more and more patients, everyone that I'm assigned to are going to receive less care, less of my time, less of my emotional support, the teaching I'm supposed to do, the critical thinking I'm supposed to do. When you tell me about how you slept last night, what kind of pain you're in, what kind of questions you have, what your home life is like, if I don't have time to process and think through and maybe connect some dots with those, I'm not able to assist the other healthcare providers, the physicians, the social workers, the OT, the PT, the RT, all of these other care providers, the respiratory therapists, everybody
that's involved. Yeah. And the interesting part too, I think, is that as patients, we get frustrated because, we might push the buzzer a million times, or, we're waiting for hours in the emergency room. So we get angry and frustrated. But I think if we just stopped long enough to realize what it is that you're going through, not just, the frustration of not having those resources, but mentally and emotionally, what kind of an impact that's going to have on nurses.
And you shouldn't have to be thinking about that. That's what we're trying to do, is that nurses will go to the ends of the earth to protect you from that. And we're sounding the alarm that we can't do that anymore. We don't have enough time to try to protect you from the current situation. And we have patients that are rationing their own care even while they're in the hospital receiving care.
So what do you suggest, or what are you proposing to be a solution for this?
Nurses are bound by their Nurse Practice Act, their licensure, to provide safe care. Yet we don't have any authority in the hospitals to determine those resources are actually available for us. And so we have the responsibility with no authority to actually make that happen. And so we're trying to pass through the legislature this year that there would be staffing committees that are nurses and hospital administrators working to come to an agreement on what staffing should be. Not just us giving input. We actually should have a say in the final numbers.
Isn't there a bill that's being considered right now as a result of this?
The Keeping the Nurses at the Bedside Act. Yep.
And how is that looking? Is it looking pretty good?
We have made it farther than we ever have before. Good. So we passed off the House floor, the Senate floor. So now what they do is the bills are a bit different, and so they have to go to what's called conference committee. So that's where we're at right now.
So is there anything we can do on our end? I would imagine anything short of reaching out to our congressmen and women.
And this bill is local for the state. And so you would reach out to your House of Representatives from Minnesota and your senators from Minnesota and ask them to make sure that they ensure that you can receive safe patient care by supporting Keeping Nurses at the Bedside Act.
Right, and obviously we all know that at some point in time we're going to need that care. We certainly do know somebody who will, so it's in everyone's best interest to act on your behalf as well as our own. So, Carrie,
Absolutely.
thank you so much for taking the time, and congratulations on your efforts. We just hope it continues
Thank
to be
you.
successful for you.